What's your name? Full name?
Jesse. Oh well, Chidiebere.
Okay. What rotation are you on currently?
Surgery.
What units?
Orthopedics.
Okay. Where did you do medical school?
Obviously, University Medical School too.
Did you take any gap year?
No.
How did you get into medical school?
By writing jam.
O level. Okay, that's O level.
Yeah.
Okay. What specialty did you think you would get into in the state of medical school?
Pediatric neurosurgery.
Wow. What specialty are you likely to get into now?
No idea.
Are there any specialties you think are not for you?
Yes.
Which ones?
Pediatrics.
Describe your medical school journey in 3 words.
Long.
3.
It was long, endless, tiring.
Okay. Are you a day or night reader?
I read when I can.
Okay. Do you consider yourself an introvert or extrovert?
I'm a bit of both.
Okay. What events stood out for you most in medical school?
COVID.
COVID. Okay. What motivated you to pursue a career in medicine?
My father.
Your father. Now this is the fun part. What's the best part of being a house officer?
There's no good part about being a house officer.
What's your funniest moment on the job?
Never escape extra call extension.
You never?
Never escape extra call extension.
Extension. Okay. What's your favorite movie?
Coming to America.
Nice. Who are your top 3 artists?
Nathaniel Bassey.
Nice.
Michael Jackson.
Really?
Yes.
And
Theophilus Sunday.
what's your favorite dish?
Anything. Any soup.
And
Gary and anything.
okay. Now this part is about work. What has been the most challenging part of housemanship so far?
Calls.
Calls. Okay. What has been the most exciting part of your housemanship so far? Exciting part of housemanship so far?
Meeting new people, learning new skills.
What's a typical day like as a house officer?
Rounds, pre-rounds, give drugs, carry out plans. Yeah.
How do you handle high pressure situations?
I eat.
What skills do you think are necessary or essential as a house officer?
I should be able to pass catheter, set line, NG2,
Okay.
collect samples, do some side lab tests.
Okay. What's the most interesting case you've worked on?
Yes, a penetrating gunshot wound to the brain.
Okay. What's the most common mistake interns make?
Sometimes we shy away from diving into our work first time.
Okay. Good afternoon. I can't shake my twins.
Okay.
Yeah.
What's up? Is it update? Is it giving money?
No, we're just having a mini interview.
Okay.
What were me?
Please.
Okay, how many hours do you work on an average every day?
Like maybe 8 hours, 9 hours.
Okay. When do you wake up
5.
on a work day?
5.
Okay. When do you leave the hospital?
Depends on my drugs to give. That's the way I go to hospital.
How many hours of sleep do you typically have?
I get as much sleep as I can. Depends on my schedule. 4 to 6 hours.
Okay. Is accommodation provided for you in this hospital?
It was, but it was crappy.
Crappy. Okay. What should guide the new doctors in choosing a place for housemanship?
Accommodation. If it comes to accommodation, the thing is that every center has its peculiarities and its problems. So, based on what you want, if you're looking to learn, advisable you go to teaching hospitals. If you're looking for free time, go to medical centers. It all depends on what you want out of it.
Okay. This is about wellness and self-care. How do you manage stress and burnout?
I eat.
What self-care practices do you prioritize?
More eating.
How do you maintain relationships outside of work?
I keep up with people.
That's vague. What advice would you give to a medical student?
Try other things outside medicine. Gather more technological skills. If you can bake. There's more to life outside medicine. Get more skills.
Okay. Do you have any artistic hobbies?
I like praying. Praying is an art.
Okay, this is about career advice. What advice did you give to an aspiring medical doctor?
Very medical doctor.
Yeah.
Well, unless you're really passionate about it, go into it. But if you're in it for money, wrong choice.
Okay. What would influence your choice of residency program?
Lucrativeness.
Okay. What qualities makes you a good doctor?
Whenever I won't say I'm the best, but whenever I get into any case and my mind is there, I try to do it my best. I like to learn things.
Okay.
And I think I go extra mile.
Nice. Were you in any association in school?
I had my own church,
What church?
Grace Assembly Cathedral.
Are you for real?
You can ask around.
Are you ordained or?
Am I ordained? I'm into ministry.
That's beautiful. Okay. If you could, what would you change about healthcare system right now?
Everything.
Really?
There's nothing working.
Okay. If you were to go back, would you change any experience that got you to where you are right now?
Yes.
Well,
Maybe I would not study medicine.
what would you do?
Full-time ministry.
Nice. Just 2 questions to go. Mention one person in your team you admire so much. Now, we don't need to call names, just maybe consultants or... None. Okay. Are you happy? Are you happy?
Am I happy?
Yeah.
With my job or with myself?
Are you happy?
I'm happy with myself.
Oh, you're happy with your job? Okay. I wish you grace.
Thank you.
Thank you so much for that.